with everything that's going on with George Floyd, Breonna Taylor, Ahmaud Arbery, I think that the Black community at large, we're in a state of being on the edge, anticipating the next worst thing that's going to happen. But at the same time, I have seen a resurgence or a refocus on mental health for Black people. More Black people are starting to see the positive benefits of therapy, and that stigmatism that associates therapy for just crazy people is slowly starting to diminish.
So current state of mental health in the Black community, I would say, is fragile. Um, Historically, we've always been the group to persevere, so it's never gonna break, but it is very fragile, and it is something that needs to be handled with care.
What the last 3 years did was really bring a broader awareness of the need for support for our mental wellness. We have historically been forced to be in the shadows, but we've also kept ourselves in the shadows. That whole adage about what goes on in this house stays in this house, like all of that kind of stuff, it has kept us locked into spaces in our minds and in our spirit that doesn't allow us to be fully Black, fully man, fully woman, fully existing in a space that has historically rejected us.
So where does one start when it comes to talking about mental health in the Black community, in the Black faith community, and in the Black church? Because those could each be different. I think, first of all, for me, just to establish who I am, I not only represent clergy, I represent a faith community, but I also, my professional life is in public health and maternal child health, where mental health, behavioral health are big pieces to that. And I think what I've learned over my over 3 decades of experience has been an evolution. And one of the most important things that sticks out for me under all of those areas would be the need for support. Because I think when it comes to mental health, having a support system is the most important thing.